It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Desert Oasis Healthcare's Dr. Renzo Corzano. Hey, Doc Renzo, how you doing?
I'm good, John. How are you?
I'm great. It's getting hot.
I know. Every year I'm surprised.
Yeah, why are we surprised?
I don't know, man. I've been here what 6 years? This is gonna be my sixth summer, and every summer I'm like, oh, it gets this hot.
Yeah. Hey, here's a question. Does people's blood thin out, when you move from a cold climate, well, your blood thins out.
I don't know, man. I don't know how people acclimate, to be honest with you,
Stay hydrated.
and wear some sunscreen.
Yes. All right. We're going to dive into this question, and it's rather a graphic one, so hide any sensitive ears. And it comes to
Mhm.
somebody who is proud to be. That's what we'll call him. He says, "Hi there. Given that there are so many older guys here in the desert, some of whom have protruding hemorrhoids, I'm wondering what, if any, health risks there are with rimming. Assuming someone with hemorrhoids has a clean butt, is it safe to rim them? Thank you. Signed, Proud to Be."
I'm only laughing because it's such a it's such a question that I would get like in the patient room, right? And so, all right, let's tackle it down. So break it down from protruding hemorrhoids.
Yeah.
I would say it's the same risk as someone not having a hemorrhoid. And I mean, there are risks associated with rimming. When we talk about risk, we're talking mostly about like infectious stuff that we can catch from someone else, right?
Yeah.
So apparently, there's little to no risk of actually getting HIV that way, unless obviously there's blood involved, and
Right.
hemorrhoids can bleed sometimes.
Okay.
So I would say the risk basically is associated with the amount of blood exposure that someone's getting,
Okay.
right? But now with like, prep and, HIV medications, I guess that risk is actually extremely low. But the other things that you can be at risk for in terms of, like rimming is just your other kind of infectious stuff like E. coli or hepatitis A or B, parasites, giardia, things like that. Kind of the same stuff that we talked about in our pool episode. Remember the feces in the pool episode?
Right.
Those are basically all the things that you can get because you're doing like mouth to anal where your feces is coming out from. That's the major risk. But in terms of, yeah, it's low.
Okay. Now, is there a treatment over the counter? Do those things work if people have the
Hemorrhoids?
aforementioned? Yes.
Oh man. So my favorite treatment to prescribe patients, sitz baths,
Yeah.
SITZ. Those actually really help. Okay. So that's one. And number two, with hemorrhoids, they're mostly associated with like severe straining and like standing for long periods of time. So the number one thing too with hemorrhoids for me is basically avoid constipation at all costs. So if
Okay.
anybody has hemorrhoids, we tackle it a couple different ways, right? You want to actually avoid hemorrhoids, so you would do like Miralax or some kind of stool softener or both together. And then you want to do your sitz baths. And yeah, the preparation H ointments are actually pretty good as well. But I actually prefer using something called Calm All Four, which are like these little suppositories that you can just like put up there, and it actually really helps.
Yes, I understand how suppositories work.
Put it up there, like
I
push it in.
appreciate
Uh,
your
you,
your visual
there you go.
representation
But you
of.
have to go all the way up because people
All
just kind
right
of leave
then.
it all the way up.
Well, it's a credit to you and how comfortable people feel about asking such a delicate question. So we
Oh my
have to
god, yeah.
say, proud to be. We're proud that you sent that question in. And if anybody has a question for Dr. Corzano, they can send it to lgbtqhealth@mydohc.com. Of course, Ask a Gay Doc is a service of Desert Oasis Healthcare. And when it comes to tossing salad, I'd rather not have mushrooms. But if they're present, the risk is not any greater than normal.
That's true. It's not. I mean, in our present, yes, absolutely not. I don't know.
We try and have fun with these things and demystify it, and that's part of the destigmatization of asking a gay doc.
Absolutely, man.
Yeah.
Yeah.
Ask the questions. There's nothing that'll make Renzo blush.
Oh, I don't know about that, but maybe. But it's funny. So
All right. Well, we so appreciate having you in the neighborhood, Dr. Renzo Corzano, Ask a Gay Doc from Desert Oasis Healthcare.
awesome.